Hello, and welcome to our lecture on the overview of operational management. In this lecture, we're going to talk about the overview of operational management in community pharmacy. When we traditionally think about community pharmacy and management, operational management is probably what we think about the most because that's probably the biggest experience any pharmacist working in community pharmacy has. And we'll talk about how no matter if you are traditionally officially named in your position of manager or just a pharmacist working in everyday operations, that out of all the different types of management that exist in community pharmacy, this is one that probably all pharmacists should have experience in. So we're going to talk about this uh, first lecture of operational management, and you'll see on Canvas what is the assignment in relationship to this operational management. And when we schedule our live session, we'll go over that case. So this week is it going to include day one, which is today, operational management, and then the following day we're going to have a lecture on strategic management, which is a little bit different. I take that back. A lot of similarities can occur, but strategic management is more of planning out future operations and the vision. And one of your midterm assignments is going to be doing strategic management of a new service. And tomorrow, at the end of the strategic planning lecture, I'll explain what that final assignment is going to look like. So what's required this week is for this first day, is to please watch this video, read chapter 6 in the pharmacy management book on operation management, and complete the assignment. So we're going to begin by talking about the differences between independent pharmacy and chain pharmacy. And as we are in 2021, the difference between the two are not that great. I bring this lecture up because my background of teaching in this course is from an independent perspective. I've worked for single independents, and currently, right now, I work for both. I work for a single independent and a multi store independent chain. So, a lot of the principles that we deal with in the chain world are very similar. And I've had the pleasure over the years of teaching pharmacists in this program, both from the independent side, but also from the chain side. So I'll reflect on that in today's lecture and future lectures. But I always like to share and that independent pharmacy is not dead. In fact, there's about 23,000 independent pharmacies across the country. And Pennsylvania actually ranks in the top five. One of the things, though, that has allowed independent pharmacy to survive is that most independents that exist today have learned to adapt, have really taken operational management principles to be able to develop new workflows embrace staff, not always just pharmacists but technicians and clerks, and to create an environment that they can survive. Because as we look at the evolving nature of community pharmacy, and we talked about this when we were together in our first live session, that healthcare in general has a great emphasis on measuring quality. And although traditionally community pharmacy is still a fee for service, that we get paid for delivering a medication to a patient, and we're mainly paid for the product of that medication and nothing more, we are slowly seeing opportunities to be paid differently from the medical benefit side, but also a lot of our pharmacy current contracts that where we get paid by the pharmacy benefit manager are value-based payment. And so we may lose money if we don't meet certain adherence measures and outcomes. There's challenges too that to be able to get contracts and to be in these preferred narrow networks that PBMs create, we have to be willing to take on some risk. in terms of a lot of these paid for performance contracts. And sometimes to be able to be in the contract, we have to show that we can meet those quality metrics and be successful. We also know that in today's environment, due to the shrinking of reimbursements, we have seen multiple companies in the chain world consolidate. We have seen some larger independents sell out due to this nature, and so constantly to be able to survive in this nature, we have to be very able to be nimble and quick and change, and also to be able to look at what resources do we have in front of us, because reimbursements are so low. And so, how many pharmacist to technician ratio can we have? What is our resources of technology that can help us? But as we look at and we start diving into the different types of management in community pharmacy, and today's topic, operation management, most successful pharmacies today are succeeding by making sure that service is not suffered, that we are providing excellent service, not to our patients, but to our providers that we are also partnering with, and making sure that we are convenient, we are accessible. That is why a lot of other healthcare providers are looking at community pharmacy to be able to help with different delivering of services, because we see the patient 7 times more than anybody else on a year to year basis. Troy Triggerstad, who is the executive director for the Community Pharmacy Enhanced Service Network, which the CPSN is a network tying states and pharmacies wanting to provide additional enhanced services, had this great quote. And I've known Troy for probably almost the last 10 years. And he has a great quote that says, as long as you're providing value in the next 10 years in healthcare, you will be fine. So, whatever company someone is working for, or whether they're their own owner, that they want to be focusing on the ability to be providing service, all right, that is going to have an impact on value. And as long as you have that, people are going to be willing to partner with you, to offer you contracts, and to give you opportunities to succeed. And we've seen both in the chain and independent world that's evolved over the last 15 to 20 years. We see this in our preventative health programs, our immunization programs, such as the flu vaccine. We've seen pharmacies grow beyond that with Tdap, pneumonia, Hep A, Hep B, and travel vaccines. And now, as we are embarking on a new venture in preventative health, which hopefully will get us out of this pandemic, we see pharmacies having to develop operational procedures. And how are we going to deliver the COVID vaccine and mass vaccinate the different phases that are going to occur for a large population? Because the way we get paid, the way contracts are based in terms of this pay for performance, we see more pharmacies engaging in adherence programs. Because we know that I share this in my undergrad teaching, that unfortunately we do not cure a lot of diseases. We may help prevent the slowing the progression of the disease. We may prevent the development of a disease. We may control the symptoms of the disease. But unless it's infectious disease or some cancers, we really don't cure. And so adherence and patient understanding of how the drugs relate to the disease, or if we're in the long-term care setting, working with the physicians and their caregivers, making sure patients are on the right medications, and making sure we're developing systems that those delivering those medications can make sure the patients are adherent. So MedSync programs, adherence packaging programs play a big role. MTM, although it has was slow in getting out when it was first passed by um, Medicare, we've seen MTM grow way beyond just Medicare D. It has allowed us a process, a way pharmacists can deliver clinical services to be able to um, you know, help patients. And now we are seeing slowly across states going for provider status, such as California and the state of Washington. Pharmacists now can bill for clinical services either to Medicaid in California, and in Washington, the state of Washington, they can actually bill for both. Commercial and Medicaid programs. And there's even more pressure, and hopefully in the near future, we're going to see provider status at the federal level. And that provider status is going to help evolve more programs. It's going to help contract us with physicians. I've currently worked with two physicians where we have collaborative practice agreements, and the physicians can bill for our service, and we have a contract to get paid by that. So this is an ever evolving thing. But whatever program you're developing, there's different types of management you have to be successful at. You have to be able to strategically plan, and that is what the next lecture is going to be about. How can we get there? But then once we come up with that plan, it is that operational manager, it is the staff under that operational manager that has to carry out that to see success. When we compare the structure of management to a chain pharmacy and an independent, the roles actually don't change much. What actually does change is that in an independent, that a lot of these roles, that owner or maybe their partner or maybe somebody who's higher up that they hire, that they hold many hats in that company. So if you look at a traditional chain company, you usually have a board of directors, a chairman of board, because most chains are corporations. You have that chief executive officer, and that chief executive officer's primary role is to see over the operation of the company, and also to be the visionary of where is the company going? Where are they going to? And so if you look at, some of the chains, recently retired CEO or soon to be retired CEO, Larry Merlot, what has he done over CVS? Is he has helped grow by acquiring and merging with other pharmacies, the company. He acquired the long-term care company, Omnicare, multiple years ago, and has saw that the PBM market, which they also own, may be slowly disappearing and or evolving, and so looked on into acquiring a medical insurance company such as Aetna. You know, you could argue whether we agree with what CEOs do, but what the goal of CEOs is that they are looking at how can they continue to allow the company to thrive, to grow. A lot of times in a corporate world where there's the demand to meet the stockholders, the investors. In the independent world, there is that owner who is hoping that they can be able to be successful so they can employ the people in their community to be able to, bring home, money to put food on the table. And a lot of times people go into being their own entrepreneur and owner of a company because they want the satisfaction of being their own boss and seeing their vision. So whether it's a chain pharmacy or an independent, there is always that CEO. There's also the chief operating officer and also the chief financial officer. And so the chief financial officer is that person who is making sure that the company is able to pay their bills, able to, meet their financial needs, to be able to be successful, not just to be able to employ people to pay them well, but also to show that there is profitability for those who have invested into the company. And the chief operating officer, as we talk about operational management, is the key one to bring out the visions and to deliver those. And under that chief operating officer, there's multiple operation people and there's multiple presidents. And then we get down to the person, that pharmacy manager. So regardless of where we are and what company, people hold many different roles. In the chain world, the advantage nice of a chain world, and especially if you're looking to move up someday in that type of environment is that you could maybe specialize in one type of management. Maybe you're in charge of pharmacy training or pharmacy purchasing, government affairs, negotiating with the state at the state level and the federal level to allow the pharmacy to thrive. Maybe you're in charge of pharmacy acquisitions or the development of clinical services. If you're an entrepreneur or an independent owner, you wear almost all those hats or you learn to delegate. No matter what area of management you are, whether it's an operational or in other aspects, you have to learn to delegate. So the chapter 6, when you read it, starts out with this case scenario. And I think this is important because most pharmacy students, when you first go into pharmacy, you may never think about management. I can even say for myself, growing up in a community pharmacy, I love the process of pharmacy, taking care of patients. But even myself left several years in the industry just because I had to go on the journey. I didn't think I wanted to be a manager. But regardless, if you want to see pharmacy succeed and grow and be able to take care of patients, we all have to have an understanding of management at least, or hold some managerial type of skills. So we have Trey Smith. He is the pharmacy manager at Smith Drug. It's a small independent pharmacy. His pharmacy performs regular dispensing, custom compounding, and sells a line of durable medical equipment. Trey has recently lost one of his senior technicians to a competitor, and he's since hired a new employee, Lisa. It's Trey's responsibility to ensure that every member of Smith's Drug staff is adequately trained in the pharmacy workflow. Lisa has no prior experience in pharmacy, but she is eager and willing to give a great effort and wants to be well trained so she can be an asset to the pharmacy team. Trey has outlined a training plan with Lisa to get her up to speed on how to count and label prescriptions, how to compound medications, and how to perform third billing procedures. One of the most experienced technicians at Smith's Drug, whose name is Bill, often handles the position of pharmacy that offers the greatest challenge, and that is the intake part of workflow, where the patient drops off the prescriptions for entry into the computer system. As part of the training for Lisa, Trey has decided to let her train at the drop-off position on a Wednesday afternoon. When he looks at it, traditionally, that is the slowest time and day in the pharmacy's work week. This has worked quite well for the past 2 weeks, but on a particular Wednesday, there happens to be a festival going on just up the street from the pharmacy. This has led to an influx of customers, and prescriptions are beginning to pile up at Lisa's stations. Customers' waiting time for prescriptions has increased from 10 minutes to 25 minutes. So, what is the most appropriate course of action for Trey to take to ensure the success of this business? So, think to yourself, what should they do? There's multiple different things that could happen. One, Trey could just pull her out, throw Bill in there, and take that. Or could Trey explain to Lisa, you know what, it's getting a little busy. Could you mind if I have Bill come, take over for a little bit? And maybe as we see that we're getting caught up, throw Bill, you can maybe see what Bill's doing and take that. Or he could say, you know what, I'm going to have Bill step in here, but I'd like you to observe for a little bit on how he's handling things, and come back to me with any questions and any difficulties you may have had during that busy period. Because no matter what, as an operational manager, one of our most important things, we're going to talk about this shortly in the upcoming slides, is we can't micromanage. We have to be able to delegate, command, and we have to make sure our staff becomes well trained and understands how to handle every situation. And so, regardless if Trey wasn't the owner, maybe Trey was a regular staff pharmacist that day, because the operational manager can't be there every day 24/7. Does that other pharmacist have the skills and capability to recognize when there are issues in workflow and being able to delegate? These are things, not only does the operational manager need to make sure everybody's carrying out the operation, but also can employees and staff problem solve and get their things out. The other important thing in operational management, no matter what, is workflow. And workflow is essential, whether it's in traditional community pharmacy, whether it's in delivering long-term care, with adherence packaging, bubble packaging, parada with a baggy system. You have to have appropriate design, and that design needs to be that we can. That design needs to be that we can be able to look at the layout of the place. And, so the facility design is so important that because if the pharmacy is not laid out appropriately, this could affect efficiency. And we want to look at our staff being able to be where they need to be able to have access to the product, to be able to interact with patients. And so there's many different steps that have to be considered in workflow of getting from the picking, somebody dropping off a prescription, whether it's physically dropping it off or it's coming from an electronic prescription, or we're getting a faxed order to point C, which is maybe the finished product. The other thing is for a pharmacy to operate, we have personnel requirements. We have pharmacists, and we're going to talk about too is, are the pharmacists doing what they were trained to do? Is the support staff, whether it's the order entry technician, the fill clerk, the clerk at the cash register, because of shrinking pharmacy reimbursements, we have seen that we have to hold many hats and everybody should be cross-trained. But at the same time, everybody needs to know what are their, traditional jobs and what are they supposed to do? What is the strategy when we need to meet high demands? We always need to evaluate whether or not, do we need to add more staff, or do we need to reevaluate workflow and how we're doing things? The other thing is we should always have written policies for how these steps are going to occur, whether it's in the product of filling a prescription or the delivering of a service like immunization. What is the procedure to be able to deliver this? Also, operational structure and process can a lot of times be impacted by clinical, regulatory, and quality requirements. We know that every state has a pharmacy act and we have to follow it in appropriate labeling and dispensing of a prescription. But sometimes it's also the handling of the medications. Recently, in the last couple of years, we've had to deal with the USP 800 for hazardous drugs. We've also had to deal with, here in the state of Pennsylvania, finally was enacted over a year ago, that physicians are required to electronic prescribe all controlled substances. We also had to deal with during the height of the initial COVID crisis, of how do we take care of patients but protect our own employees and also other patients coming to the store with social distancing, being able to intake prescriptions safely. Do we take back refill bottles? How do we do that? The other thing in terms of of other quality requirements are such as what are the steps and procedures in to giving immunization, how to dispose of needles, the safety of those needles, how to get rid of sharps container. We have regulatory requirements in terms of inspection. How do we get rid of outdated drugs? So all of those things go into play in developing. And then we also think about how do we incorporate adherence programs, MTM services into that operational structure. It's the biggest thing is needed and important is to understand the primary role of the pharmacy business. All right. And we should always be remembering is that we need to take care of patients. And we also have to remember, what do patients want? Whatever service industry you're in, there's two things customers and patients always want. They want their problem solved and they want to feel good. And if you can deliver those two endpoints, then we will take care of that patient. Peter Drucker, who's mentioned many times throughout the pharmacy management textbook, and was a leader in management principles altogether, wrote that the idea of any business existing is to serve society, and pharmacy and all healthcare businesses definitely play that role. So therefore, a company should focus on serving its customers, and profits are simply a required resource for the company to continue to serve society. But we have been challenged in community pharmacy because we want to be able to deliver to our customers, and we want to be able to deliver them in a timely fashion. But maybe some of the things we've done to deliver is more commoditizing our industry, that through drive-throughs, through what people not wanting to wait, not understanding the importance of what we're doing in terms of med safety, making sure there's no drug interactions, interacting with the physician if there's a problem. So we are constantly battling in our operational structure and workflow process in community pharmacy of how we can deliver this. I think what anytime, and this is just me, John D. Rockefeller, famous entrepreneur in the coal industry, in the 1800s. And yes, he has nothing related to pharmacy, but he had a great quote. Success is doing the common things uncommonly well. There are many things we do in our everyday workday that somebody may look at as very mundane. And one of the things that is dangerous, especially in our type of business, that we need to be doing these mundane things uncommonly well. How do we package a prescription, whether it's in a bottle or adherence packaging? How do we communicate with the patient, whether it's the intake of when the patient delivers it, or we're talking to a patient, counseling them, or adhering? The other thing is we need to develop a workflow and a work environment that the pleasure in the job puts perfection in the work, that our employees understand the mission and vision of our company so that we're key and able to be successful. Within the book of chapter 6, they go through a scenario of why do most people go to pharmacy school? And if you ask people initially why they go, or they're in a college interview, the pharmacy student is never going to say it's because I want to make lots of money, and I want to, but they may say that it may be an aspect of them that I went into pharmacy because I knew that it did make good money and I'd be able to provide for myself and my family. But most people, when you ask them why did they go into healthcare, is because they wanted to take care of patients. However, if that same person was told that their current wage was going to be only $10 an hour, and therefore a full-time pharmacist working 2,080 hours per year, they would earn a little bit over 20,000 per year. And if they had student loans, which could be well over the hundred thousands, and this is probably just an underestimate that's listed here in the slide, is that they're just in interest alone, that over 10 years, it would cost them about $14,900 a year in student loan payments. So therefore, that would leave very little for a pharmacist to live off of. And so the reason why I bring this up is that all pharmacists, regardless of if they don't like management or not, they need to understand the economics and the financial realities to the business. They need to understand that in any profession, there are necessaries to go into the business to provide patients, to serve society. But they have to understand that they have to be profitable. And whether it is a private company that is in the business to make money, or whether it is, a nonprofit, the goal is to stay in the black and not in the red. So an employee, whether they are traditionally a true manager or an employee that is going to be delivering out the operations, they need to understand the mission of the company. They need to understand what it takes to operate the business. Both NCPA and NECS pharmacy associations did a cost study over 5 years ago, and they found that the profit that needs to be made on average for every prescription needs to be somewhere around close to $11. And if you take inflation over the last 5 years, that's probably about $12. And if a pharmacy can't make that, then they're not going to be able to keep their doors open, not be able to pay their operating expenses. So it's important that all pharmacists, even if they are not a manager, understand, and we talked about some of this in our introduction lecture, of understanding that a pharmacy has to bring in sales, whether that's with product or service. And if it's with product, we need to be able to manage our inventory appropriately to be able to have a gross profit. And we need to have enough gross profit that it can cover our operating expenses. And when we can't do that, that is where we sometimes have to cut salaries, cut staff, cut operation hours, and we'll talk about that in the second part of this management course, when we start looking at financial analysis. So it is the role of the operation manager in any business to ensure the smooth function of the business unit to achieve both its public and private mission. And the manager is in the public service institution faces the same task as a manager in a business that is for profit, is that we need to perform the function for the sake of the institution to be able to make work productive and the worker to be able to achieve what we're looking to do, and that is to take care of patients. And we need to be able to do that in an efficient way and a cost controlling way. Operation managers must understand lots of different aspects of the company, such as, what is the vision and mission, the goal of the organization, and then how can we direct that to the people that are working under us. The operation manager needs to know the management structure of the organization requires, multiple roles to be played. And so what do I mean by that? Well, the operation manager needs to be able to understand, um, you know, who's in charge of what is the role of each employee. As I said earlier, when we're comparing independent to chain pharmacy, there are various titles that occur in a company. Whereas you have the chief executive officer whose responsibility is to direct the strategic planning of the organization. You have a chief financial officer who directs the budget and financing activities. And then you have the chief operating officer who's responsible for the day-to-day. And then you have the managers under that. But those managers under that have to understand what is what does the chief operating officer see on how we're going to deliver the day-to-day to meet the outcomes. But that also manager may also have to understand what is their budget in terms of ordering supplies, how much they can order per week in their inventory, how much hours, FTE hours can they schedule. And so we have to be aware of all those things. At the most basic level, operational managers must decide what must be done right now, who needs to be doing it, what resources do they need, what resources do they have, and when is the work finished. And so we need to be able to, as managers, understand that, but at the same time, we must be able to deliver that to the staff under us. So the operation manager holds many different roles within their day-to-day tasks. They have to understand what are the services and goods that the business is delivering. They may not be the one who develops and sets the pricing of it, but they must understand why is it at this pricing and how are they going to relay that to both providers, patients, and staff. Looking at what is the best workflow to reach that outcome. And this is constantly an evolving thing. How do we measure success of what we're doing? Looking at our productivity. How do we measure our productivity? What metrics do we look at? And are these metrics still applicable to what we're doing? How many prescriptions do we fill per hour? If we're doing med sync, what is our med sync percentage compared to, everyday prescriptions? What's the best location for perhaps a service to be offered in the pharmacy, such as immunization or MTM counseling? Do we have to look at our physical layout of the store and how can we change those things? Human resources, which we're going to talk about later on in the course, but how do we motivate and inspire people to do excellent work? Most of the time, employees, yes, they want to be paid well, but a lot of times employees, to be successful, want to be engaged. They want to understand what their role is and what is their role in relationship for patients and customers. We have to deal with scheduling. Scheduling has been a very challenge in this past year with people who may have to quarantine due to being exposed to somebody with COVID. We maybe, had cut back in FTEs. And we also have to understand is when we do schedule, what is the best employees for maybe certain days of the week, or maybe certain pharmacists may need better support than others. And if they do need that, why is that? And can we train them up that they may need less staff, or we need other staff to be able to step up so we can meet our demands? The other thing we may have to look at in operation is supply chain management. Are we getting the inventory? If there's a shortage of a drug, how can we deliver that? There's the inventory management. That inventory is constantly a battle of how much do we need to keep on our shelves? What is our weekly or monthly budget? And also, are we keeping up to date on our equipment, the maintenance, and are we working with those in charge of what may need work, software updates, or implementing some type of new technology into the pharmacy? So that's a lot of the things that the pharmacists do. Now, in chapter 6, it also talks about um, a lot of different theories in pharmacy. And one of the theories that I really do like that is listed here is what's called the theory of command and intent. And what the theory of command and intent is, we want to make sure that employees are working on the right tasks at the right time. And one of the things that we want to be able to make sure as a leader, as a manager, is, and I said this earlier, is we don't want to micromanage. We need to be detail oriented. That's always good, but we want to make sure our employees are trained appropriately so that they can perform the right tasks at the right time. And if they're not, we need to be able to figure out how to do that. Command and intent actually comes from um, the service. And when I mean the service, I'm talking about the Army or the Navy or the Marines. And if you look at a general or a colonel, command and intent under them is that they are aware of what is the desired outcome in relationship to the mission. And they know what the end point is. But then they have to be able to be nimble and adaptable of how to get to that end point. And we know that that happens every day in a community pharmacy. Think about, we might be having a good day, but what if we have a med error occur, or we have a disgruntled customer? What if we have a staff member go down sick? What if, we have that one of our robotics goes down? What are we going to do to still be able to focus on the endpoint of getting that medication to the patient, and how are we going to change to be able to be successful and be able to meet the vision and mission of the company? So command and intent is that if employees under the operational manager are aware of what the desired outcome is, and they know what the endpoint is, that they should be skilled and to be able to get to that. And so how can we get employees to that understanding? Well, let's look at goals for a pharmacy manager. We want to be able to improve speed and efficiency of patient service. So we are always constantly analyzing, are there bottlenecks in the workflow? Is the pharmacist's time being used efficiently? Is the business meeting its productivity goals? We can do this by looking at metrics. One thing most good pharmacies have done has used their pharmacy software system to use workflow. And workflow, we can get reports of how many prescriptions are filled, per hour, how many are still in a print queue, how many are in a holding queue, how many prescriptions are maybe not being picked up, what is the average wait time at the pharmacy. So we can have these different metrics to evaluate and manage them, and make adjustments. We may want to offer more services to patients. Is there a service that the pharmacy customers want or need, or they're not being currently provided. How would we provide that? No. So as we are being challenged. Most community pharmacies offer immunizations, but as we are starting now to be able to offer COVID vaccines, this is a different type of workflow that might need to be addressed. And how are we going to be able to do it? It might not be done in traditional workflow just because of all the steps that have to go, but traditional workflow might be important to help educate patients about who now qualifies for the vaccine. How can they make an appointment to sign up to get the vaccine? Where do they may need to go? Maybe it's not in your store to get there. So, but it's still part of the company. So offering more services, how can we incorporate, adherence education within our everyday workflow? Another goal for pharmacy managers is creating and maintaining a collegial work environment for employees. And so, do our employees enjoy working at the pharmacy? Maybe we do some surveys of our employees. We do an at least yearly reviews or maybe quarterly reviews or the 90-day review for a new employee. Are they challenged to excel? Does the team work well together when it matters? Does everybody understand each other's role? Are job descriptions clearly defined? Another goal of a pharmacy manager is to improve the knowledge of the healthcare team. Can the pharmacy staff use their talents to improve each other's? Does people speak up when they identify that there's a problem? And how can we then share what that problem is and work together as a team to improve that efficiency? And can the pharmacists educate their staff of why are we doing things, understanding on how, what's the importance of why we do this, maybe from a clinical perspective, not just always a business perspective. And so these goals are important because these goals, help us, meet our mission and vision. So, what are some tasks can operation managers do to obtain these goals? So, for example, goal one, improving the speed and efficiency of patient service. So, have we cross-trained staff members to do each other's job, especially if there's call-offs or people calling off sick? Have we looked at, maybe we need to upgrade the computer system? Maybe we need to incorporate additional steps into workflow. Maybe we need additional computer terminal. Maybe we need to look at, when do people take lunch and the overlapping of staff. Goal two, talking about offering more services. Maybe we need to develop a customer survey to see what services patients would want. Maybe if we implement a new service, we need to look at how did they like it and what were their thoughts of it. Maybe we talk to our own employees and what do they think there's opportunities. Is everybody trained or certified to be able to deliver new service, particularly our pharmacists? And maybe they need to get more additional training. The other thing is the layout and to be able to deliver that. Goal three, creating and maintaining a collegial work environment for employees. So are there opportunities for employees to move to different positions? In our company, most of our order entry technicians come from the field clerk aspect, and it is always good to see that transition come because those people have an understanding at the basic level of what is the goal and the intent of the company. Do the, maybe having one-to-one meetings, maybe having a special lunch or an outside meeting. And if we do have meetings with our employees, are we creating an agenda for them? Are we, setting goals of what that meeting is? Are these regular meetings? Are we only a manager that has meetings when there's problems versus having meetings to be able to identify where there's problems and also to have a meeting to acknowledge people's success? Goal four, improving the knowledge of the healthcare team. Are we providing them tools? One of the things we just did recently, we're rolling out two new services. One is an asthma program that we're going to get paid by a Medicaid provider. And another one is we wanting to engage our pharmacist and staff more into our outcomes MTM. And so we offered, we did, because of COVID, we did Zoom meetings, but we had educational meetings. And we not only educated the pharmacist, but we also educated the other staff, including the order entry technicians. When you also look in chapter 6, it talks about a lot of different theories. And one of the theories it talks about in terms of management is what's called the principle of the human sigma. Now, the human sigma was defined by the Motorola company back in the um, during the Industrial Revolution. And what the Sigma focused on, what are the steps needed to be successful in operational of a company? And the steps were the following: define, measure, analyze, improve, control. So define what you want to do, measure what you want to do, analyze what you do, improve it, and how can we control that we can replicate that. And that's great, especially like if it's in the car industry. But when they tried to apply this to the healthcare industry, it didn't fit in right away. So the Gallup organization recognized that this inability of this type of sigma, and they created the human sigma. And the human sigma is the following. The first one is e pluribus unum. And what does that mean? Well, it means that the employee and the customer experiences should be measured and managed under the same department. The employer customer experience is directly linked, and to manage them separately would be inefficient. And so, one of the goals, and we see this in pharmacy, is that pharmacy manager oversees not just the oversees the all operations of the pharmacy, and the operational manager maybe above that pharmacy manager, like a district manager, oversees that. Are they getting the right employees? And human resources can play a role into that too. Feelings are facts. Basically, the Gallup research found that customers that contribute the most loyalty and therefore the most business to a company are the ones that feel an emotional connection. We see this with, social media. We see this with wanting to be, the shopper programs. We see this with, one of the things with social media and websites is providing, articles, resources, featuring staff, but they want to be involved with that. The other one is think globally, measure, and act locally. In an environment where there are multiple locations run by the same management, it will be easy to assume that all locations will achieve the same results. And I can speak, overseeing the 7 pharmacies here in my one business and the one pharmacy in my family-owned business, is that although we try to do the same things from a management type of principle, that each place has its own persona, has its own type of staff, has its own type of local doctors, and we need to be able to make sure that we are managing that location in that aspect. The other is there is one number you need to know. And basically, what this suggests there is what is that one performance metric that strongly predicts the success of that company? And so, obviously, that could be customer service surveys, that could be looking at, repeat customers, how many transfers occurred that month, how many new patients occurred that month. So, all of those things can play a big role of what is the right metrics to. And the last one is if you pray for potatoes, you better grab the right hoe. And what that means is the manager should gather the correct data in order to efficiently evaluate their customer company's performance and set goals. And so making sure that we have the right metrics of what we're looking at. And so this is so important. And when we meet for our discussion on operations management, we'll talk about what data maybe you use in your company and what data. So start thinking about, what are great metrics to evaluate. A lot of times pharmacies look at metrics such as inventory turnover. As I said, they look at how many immunizations may have been done, how many new prescriptions, how many new patients, how many people signed up for med synchronization, how many people got a certain product or sale promotion of that month. So there's lots of different metrics that you can look at, but you want to be consistent of those. The other things is, and we will talk about this also in our human resource lecture, is we need to have employee engagement. As I said before in that command of intent, if as the leader, as the manager, you need to make sure your employees understand what we're trying to achieve, but they also need to understand, out of this, what do I get? And it's not always, financial, reward. It's also satisfaction, employee recognition. What do I give? What are the jobs that I am required to do? What is my job? What is my mission? A lot of times, companies that, suffer or aren't successful is when employees don't know, what do I need to do? And especially then if they're reprimanded for something they didn't do, but maybe they didn't understand what their purpose was to begin. And do I belong? Creating that team approach, that there shouldn't be a divide between I'm the pharmacist and you're just the clerk. Making sure that everybody understands their role. There's a famous story when John F. Kennedy was visiting Cape Canaveral, and he came across a janitor, and he asked him, "Well, what do you do here?" And he said, "Well, I sweep the floor, sir." He said, "No, you do more than that. You make sure this place is clean and has a great environment for our scientists." So basically what you're doing is you're part of the team, and you're helping us meet our mission of getting a man to the moon. The other dimension of employee engagement is having their input of how can we grow, what things they think might be, good at to be successful. Yes, we have our CEO and our, CFO and our strategic planning team, but we need to have input from our employees to be able to be successful. So, in summary, the daily work of an operation manager is to get tasks done right, get tasks done in a timely fashion, consistent with the values of the organization, in a way that creates a long term value for all stakeholders in the business. And so, as you read chapter 6, it will reinforce what I've mentioned here in this lecture. And as you complete the assignment, please think about, what are those roles? And even maybe you currently, right now, are operations manager. You may move up in a company where you then have to make sure that your operation managers are doing the tasks that you have laid out to deliver the mission and vision that you have laid out. Thank you very much.